Let's talk about seizures or epilepsy. Epilepsy is when somebody has two or more unprovoked seizures. So if you have two or more unprovoked seizures, it's epilepsy. There are two types of epilepsy: partial onset and generalized onset. Partial onset is the most common type of seizures or epilepsy, and it starts when somebody is having seizures from one side of the brain. So you can have a seizure because somebody has a scar, or you have a old injury, occur from a traumatic brain injury, can occur from a childhood scar, can occur from seizures, can have fever during childhood, which are called as febrile seizures. So anything really where there's a scar on one side of the brain, especially in the temporal lobe, you can have partial onset seizures. Now, if the seizure stays only on one side of the brain, then that's all you're going to get, meaning you're going to get what we call it the partial seizure. So if it's coming from the frontal lobe, you'll just get shaking of the other side of the body, or you might just get a smell if it's coming from the temporal lobe, a feeling in the pit of your stomach, a deja vu feeling, and then if it spreads to the other side, and only if it spreads to the other side, then you get the grand mal seizure. But if it stays on one side, you're only going to get the partial seizure. And the aura, the partial seizure before it spreads is called an aura. That's how you know it's a partial onset seizure. Generalized onset seizures, on the other hand, start simultaneously on both sides of the brain. And the most common type of generalized onset seizure is juvenile myoclonic epilepsy, or JME. Generalized onset seizures only account for 10% of all seizures, usually start in the teenage years, and the patients get grand mal seizures without any warning, without any aura, because it starts simultaneously on both sides. You can also get myoclonic jerks, which is sudden jerk of one of your limbs or all four limbs, usually occurring when you're wide awake, and the jerk is very brief. Or you can also get petit mal seizures, which is just transient blinking of the eyes, usually just for a few seconds. So when you see the combination of those type of seizures, you think of a generalized onset seizure. Why is it important to determine if it's partial onset or generalized onset? Because the medicines can be different, and I've seen a lot of patients where they have been diagnosed as partial onset seizures and treated simply with the wrong medication when they actually have generalized onset seizures. Regarding the medicines we use to treat, I prefer the newer anti-epileptics. The older medicines like Dilantin, phenobarbital, Tegretol, Depakote, I feel there are too many side effects. There's a lot of drug interactions, osteoporosis, narrow spectrum of action, especially with Dilantin and Tegretol, where they both work on the sodium channels, and they both really only treat partial onset seizures. The newer anti-seizure medicines, even the generic ones, Keppra, Lamictal, Zonisamide, the branded medications, Fycompa, Vimpat has now become generic. There's a lot of medicines which treat generalized onset seizures and partial onset seizures. Broad spectrum anti-seizure medicines, definitely prefer those. If somebody has partial onset seizures, then I prefer Trileptal, Aptium, Oxtellar, the carbamazepine derivatives rather than carbamazepine itself.